Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the December 29th, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County and the entire state of Iowa continue at high transmission for COVID-19 with 305 cases reported in the last 7 days. That's about the same as last week's 7-day total of 315, clearly indicating that transmission is still a high risk. And the amount of people getting tested also took a big jump on Monday following the long Christmas weekend. The biggest source of protection against COVID-19 right now is the third or booster dose of vaccine. So if you're 6 months past the second dose of the Pfizer or Moderna vaccine or 2 months since you've received the single dose of J&J vaccine, get your booster. As breakthrough cases are occurring for those who are fully vaccinated but not yet boosted, and they're being infected with both Omicron and Delta variants. Check the city and county website COVID-19 tabs for vaccination sites and times. And now, on to the biggest news of the week, the revised isolation and quarantine times. Given what we currently know about COVID-19 and the Omicron variant, CDC is shortening the recommended time for isolation from 10 days for people with COVID-19 to 5 days if they're asymptomatic, followed by 5 days of wearing a mask when around others. The change is motivated by science that shows the majority of viral transmission for COVID-19 happens generally in the 1 to 2 days prior to the onset of symptoms and the 2 to 3 days after you develop symptoms. Therefore, people who test positive should isolate for 5 days, and if at the end of those 5 days they don't have symptoms, they may leave isolation if, and only if, they can continue to mask for 5 days to minimize the risk of infecting others. So that's the new rules on if you test positive and have COVID-19. There's also new guidance for if you've been exposed to a COVID-19 case. For people who are unvaccinated or not boosted, CDC now recommends quarantine for 5 days, followed by strict mask use for an additional 5 days. Now, if you're fully vaccinated and have received your booster shot, you do not need to quarantine following an exposure, but you should wear a mask for 10 days after the exposure. And for anyone, if you've been exposed and symptoms occur, you should immediately quarantine until you have a negative test showing that the symptoms are not due to COVID-19. And finally, for anyone exposed, it's recommended to get a COVID-19 test at day 5 after exposure. So now you're probably wondering why recommendations for quarantine are different for those who are fully vaccinated and those who are also boosted. The fact is that data consistently shows that people who are boosted or are less than 6 months out from their primary vaccinations have the highest level of protection from COVID-19. So given the increased protection against our new not friend Omicron, those who have received a booster dose are at low risk of SARS-CoV-2 infection and are therefore at lower risk of transmission to others during the period following exposure. Another question that may come up is why are isolation recommendations the same for those who are unvaccinated, vaccinated, and boosted? Well, again, based on available data, anyone who becomes infected with SARS-CoV-2, regardless of vaccination status, is maximally infectious for approximately the same amount of time. If you test positive and have COVID, you have it, and you can spread it, no matter what your vaccination status. But the fact remains that COVID-19 vaccination decreases the risk of severe disease, hospitalization, and death from infection, and also decreases the risk of SARS-CoV-2 infection altogether. Regardless of vaccination status, the majority of COVID transmission occurs early in the course of illness in the 1 to 2 days prior to onset of symptoms and the 2 to 3 days after. Think about the Iowa Department of Public Health report for December 27th. It shows that 79% of those hospitalized with COVID-19 as a primary diagnosis are not vaccinated. And of those COVID-19 COVID-19 patients in the hospital ICU, 81% are not vaccinated. So, as we make plans to ring in the new year for the final stretch of holidays and 2021, remember to take a look at your own risk factors and of those you live with and may gather with. My friend Dr. Michael Osterholm of the University of Minnesota Center for Disease Research and Policy said the other day in the New York Times, if you're having a holiday gathering right now, chances are that 1 in 10 people in that room is infected and doesn't know it yet. With that, you may want to keep your celebrations small and consider testing before going out or getting together with friends and family. Finally, thanks for tuning in today and throughout 2021. I wish you all a safe, happy, and most of all, healthy new year in 2022.